Okay, today let's again revisit the dangers of smoking. Let me be very candid and very open about the dangers of smoking. We've had not one, not two, not three. We've had really very many cases whereby even the immigrant community, especially from Africa, are really having it very rough when some members from that community are smokers. And this is not only a problem with the immigrant community, but with so many other people out here, especially who try or does smoking as a habit. And it's really a very big problem nowadays. And the best option for us to do is to try as much as possible to stop this smoking. So if we are going to do the very best option to stop smoking, it is not actually going to be a problem, especially for the youths or for the adults. So let me give you a few remarks on the dangers of smoking. One of the serious causes of smoking is cancer. Smoking causes a widespread and severe damage to nearly every organ in the body, leading to a wide range of dangerous and often fatal health problems, in addition to the direct effects on a smoker's health. It also poses a significant risk to those exposed to second-hand smoke, including an increased risk of cancer, respiratory issues, and other conditions. First of all, let's talk of cancer. Tobacco smoke contains a cocktail of toxic chemicals that are well established as a major cause of cancer. Smoking is the leading cause of lung cancer and increases the risk of cancer in many other areas of the body, especially lung cancer. And from the health department, let me talk of CDC. Smoking is responsible for over 87% of lung cancer deaths. Can you imagine? Over 87% of all lung cancer deaths. And the other cancers which are also developing, mouth, throat, esophagus, stomach, liver, kidney, pancreas, colon, and bladder, is also significantly higher for smokers. Well, let's talk about leukemia. Smoking is also known a cause of acute myeloid leukemia. And then let's talk about cardiovascular diseases. Smoking damages blood vessels and the heart, dramatically increasing the risk of serious cardiovascular events, heart attack and stroke. Exposure to tobacco smoke causes immediate damage to blood vessels and makes blood more likely to clot, which can lead to a heart attack or stroke. Atherosclerosis. The buildup of plaque in arteries or atherosclerosis is usually accelerated by smoking. Aneurysms. Smoking increases the risk of developing bulges or weaknesses in the arteries, such as an abdominal aortic aneurysm. Peripheral artery disease, or PAD. This condition, where narrowed arteries reduce blood flow to the limbs, is a common risk for smokers. Let's talk about respiratory diseases again. Smoking is the primary cause of COPD, which includes both chronic bronchitis and emphysema. These diseases cause coughing, shortness of breath, and damage to the air sacs in the lungs. Asthma. Smoking can trigger asthma attacks and increase the severity of the disease. Let's talk about tuberculosis. Smoking increases the risk of developing tuberculosis and can also make it recur. Respiratory infection. Smokers are more susceptible to infections like pneumonia and influenza. Wow, this is another serious one, especially for the young generation or the ones who are trying to start a family. This is very serious, especially to the young couples. Avoid smoking. Smoking has profound negative effects on reproductive health in both men and women and can seriously harm unborn babies. So please stay away from smoking. Pregnancy complications. Smoking during pregnancy increases the risk of miscarriage, ectopic pregnancy, preterm delivery, and having a baby with a low birth weight. Infertility. Smoking is a major cause of fertility issues and can make it harder to get pregnant. Birth defects. It can also cause congenital malformations in babies and increase the risk of sudden infant death syndrome. Erectile dysfunction. Smoking is a significant cause of erectile dysfunction in men. And we have so many other problems associated with smoking, like diabetes, immune systems, vision problems, oral health, appearance. Let me explain a little bit about appearance. Long-term smoking contributes to the premature skin aging, wrinkles, and loss of skin elasticity. Then we've got the mental health perspective. While some report temporary feelings of relaxation from nicotine, smoking is associated with an increased risk of neurological disorders and can have a complex effect on mental health. So, my viewers, if it were possible for us to avoid smoking, it can really increase our chances to longevity and ensure that we live a healthy life. The children we have, the relatives we are staying with, our friends we are staying with, can also not get some of these effects from smoking, because it doesn't really matter. You might be thinking that it's only affecting you, but second-hand smoke has also been a cause to health concerns or problems, especially to the children or to people susceptible or having pre-medical conditions. This has been proven, and that's why there are so many laws which were made whereby, especially when you are taking a plane or when you are in a plane, you cannot be allowed to smoke. When you are in a restaurant, there are so many strict areas where you cannot smoke. In schools or in public places, you are not actually allowed to smoke because of the second-hand effect of smoking. So let me leave you with this one sentence. Smoking increases health risks or diseases like cancer. So please avoid it at all cost. Thank you very much. Till next time, may God bless you.